So movement. Movement is what our bodies crave. We are designed to move. Our cells want movement. Joseph Pilates, back in the 1920s, immigrated to the United States, and he brought his principles of movement with him. His three guiding principles were whole body health, whole body commitment, and breathing. The idea that we are intertwined and all of these things function together. Movement has some quotes. Eric Franklin stated, "We are designed to move well." Joseph Pilates says that movement should be spontaneous. And William Gibson, a physician, said, we see to move and we move to see. So movement is ingrained in our bodies. So the first part we want to look at is breathing. So we want to look at breathing in three different ways. We want to look at it this front to back breath, this lateral breath, and a three-dimensional breath. I'm going to show these breathing movements in a seated position, but know that you can move around your own body as well as your patient or client into different positions, lying on their back, lying on their side, even in a hands and knees position, and see how that different position of the body changes their awareness of the breath. So looking at different breathing patterns, the first breathing pattern we want to look at is this anterior-posterior breath, where you can take your hand on the top part of your client's or patient's breastbone and your other hand on the lower part of their rib cage. You want to cue them to breathe into your back hand. So you want to think of this breathing pattern handling like a bucket handle, open and close. Moving on to a lateral breath, you change your hands to the sides of your client's rib cage. Ask them to inhale into your hands so they move out to the sides of the room. Exhale, drawing those arms back in, feeling like to cinch the waist. So letting as much air as we can come into the outsides of the room. Exhale, draw it back on in. Now we want to combine that anterior-posterior and lateral breath and really make the diaphragm move in its three-dimensional quality that it's designed to do so. So remembering that image of that umbrella that's flipping upside down and coming back on up. So we want to get all around that rib cage. So being able to breathe front, back, sides, all of it trying to move equally both in and out. Now we're going to progress our exercises onto looking at shoulder mobility for pelvic stability. So the exercise that will be demonstrated is arm arcs, and the concept of why are we concerned about our shoulders moving when it comes to pelvic control. So the idea being that our shoulder blades are the kneecaps for our pelvis, that we need to be able to allow for that movement above to have better movement below, or stability below as well. Shoulder mobility for pelvic stability. We're looking at a mat exercise called arm arcs. Very simple movement, just moving that ball of the shoulder in the socket, but we make sure that the client is lying down onto their backs, knees bent, feet flat. Keep your pelvis nice and level, meaning that pubic bone is facing parallel towards the ceiling. As many ribs as possible are touching the surface as well. With an inhale, start to float the arms up. Exhale as the arms continue to go overhead. Inhale as the arms start down, and exhale to finish the motion. As the client moves through this range of motion, you can change the movement pattern into a scissoring pattern, just allowing that sense of opposition to happen in the body, which is what happens when we walk, but looking the whole time as we're allowing the shoulders to move in the socket, keeping the pelvis still. Getting that opportunity to work on the breath pattern as the arms move. Making a check to make sure their legs are still lined up, feet anchored, second toe, shin, thigh bone. Changing those arms into circles to add a different challenge that we're moving the body in a different plane to gravity versus staying in that sagittal plane, moving into that frontal or coronal plane. Our next movement is going to be thoracic mobility for pelvic stability, and that movement is book openings. So the idea of improving movement in the rib cage, in this thoracic spine, to improve stability into the pelvis. If parts of our body are stiff and not moving well, other parts will try to take over or do their job. And they're really not designed to do it. They're not designed to do it efficiently or effectively. So we want to make sure that all parts are moving at the best that they can. We move onto the exercise book openings, looking at how the thoracic spine moves and its relation to the pelvis. So looking at placing the client on their side, lining them up shoulder, rib cage, and pelvis, knees lined up pointing straight forward, hands behind the head, and slowly rolling the upper body away and then returning back onto the side. Inhale as you roll back, exhale as you return over onto the side, noting that the pelvis stays looking straight forward towards the front. If the individual has some discomfort in their top shoulder, they can go ahead and place their top hand across their chest to allow the movement to be a little less strain in the shoulder and still continue that thoracic mobility. Inhaling as you roll back, exhaling as you return forward. Our next exercise is to look at hip mobility in relation to pelvic stability and looking at the pelvic floor. And the exercise that we're choosing is bent knee openings, a simple exercise where it's just moving the leg out to the side and coming back in, but looking at moving the femoral head or the head of the thigh bone, the hip, the ball of the hip, in the socket and keeping the socket still. So we're looking at how does the pelvic floor work to help provide that stability without thinking so hard that the pelvic floor needs to tighten to help provide the stability, but it only needs to do what it needs, the amount that it needs to work to provide that stability to allow for that ball of the hip to move in the socket. Hip mobility in regards to looking at the pelvic floor, the exercise we're looking at is bent knee openings. So the idea here is that the client is lying down, knees bent, feet flat. Keep the pelvis level one side to the other and allow one leg to open, rolling to the outer edge of the foot, and then gently draw the leg back on in. There's a good fascial connection between the inner thigh muscles and the pelvic floor. So this allows some pelvic floor engagement without having to think so much about how the muscle is firing right away, being able to know that there's funneling going through. So the client's just allowing the leg to slowly open with control and then drawing it back on in, doing a nice breath pattern in and out as it goes. To make it more challenging, you draw the legs up into that tabletop position and open and close the legs from here. That allows more of an abdominal connection into the workout, which we know is that the abdominal muscles and pelvic floor muscles, the deep abdominals, work together to provide that support to this core structure. Next exercise we move on to is abdominal strengthening. So there's a lot of times we start looking at abdominal exercises putting more strain or pressure on the pelvic floor. So how you do it is very important. We want to think of this chest lift exercise of this nice curling up. We're reaching long to get up and over versus a crunch. A lot of people in an abdominal exercise, they just want to crunch. And even as I'm sitting here and doing this, you can see my rib cage is pushing down towards my pelvis, which pushes more pressure on the abdominal organs, pushing more pressure onto the pelvic floor. So we want this symphony of working all in this middle part of our body working together. So the exercise, chest lift. Chest lift, looking at abdominal strengthening in relation to the pelvic floor. So the client's going to start lying on their backs, bringing their hands behind their head, taking an inhale. As they exhale, they're going to curl the upper body up, inhale to lower down. With that curl, we're really thinking how well can the body lengthen to curl up, thinking that we're trying to reach our heart up and towards the upper part of the knees. The gaze is looking up and out. Adding to the motion, we reach those hands behind the legs, pull a little higher, stay there, bring the hands behind the head and lower on down. So inhale to prepare. Exhale to curl up. Inhale to reach the hands behind the leg. Exhale, use those arms to curl up higher, thinking long. Inhale, stay there. exhale to lower back on down. We're really working on the sense of lengthening and noticing that the pelvis stays level. So the pubic bone stays parallel towards the ceiling the entire time. The arms are helping us stretch in that upper back area, in that thoracic spine, to be able to curl up a little bit higher. To add as a modification, if somebody feels some strain in their shoulders or their neck, you can grab the edges of the mat to work on the curl up portion. As we grab the mat, you're thinking you're pulling the mat out and up. So we're drawing an arcing movement as we do the movement. Our next exercise is to look at spinal extensor strength. So that's the back side of the body. And our exercise is swimming. So we want to make sure that we look at the whole body on all sides, front and back as well as the sides. So we want to be able to know that as you're lying on your stomach, arms and legs can extend, we're able to still keep that same alignment, keeping all of those rings lined up. The tendency when we lie on our stomach is to allow the front of the body to sag towards the ground. And by doing so, even in the seated position, you can see how that changes my pelvic alignment. I'm reaching closer towards the camera. So we want to try to keep that connection in the front of the body as we're working the back of the body. And knowing in this role, the pelvic floor is providing support to that pelvis. Looking at spinal extensor strength when it comes to the pelvic floor. So lying down onto your stomach, having the arms out in front and legs out in front, we're keeping that lift of that pubic bone gently towards your belly button so we avoid the sense of a sag of the front of the body. We still want to keep our rings lined up. So thinking of that ring image we talked about earlier with the shoulders, rib cage, and pelvis. Starting first with just an arm lift, then just a leg lift, adding it to opposite arm and leg, then proceeding to all limbs coming up, holding all limbs and doing the nice fluttering of the arms and legs. As this fluttering is happening, the body feels like it's reaching long, so do the legs. The breath pattern is smooth in and out. Our cornerstone exercise when it comes to the pelvic floor is bridging. Bridging is an exercise I give to all different types of patients and clients from the get-go. It starts to teach the idea of movement, and it also starts to teach the idea of efficiency of movement. Only working the muscles and the muscles working at the way that they need to be successful with the exercise. It can be challenging a lot of times in a bridging exercise. People just want to move quickly, or they want to tighten the muscles in the back of their thigh to try to make the exercise more than what it is. We want this exercise to be this nice wave-like movement, and that's where it's the basis, the cornerstone of this whole pelvic floor. Looking at this symphony happening within this whole midsection of the body, the control of the breath, the work of the abdominal muscles as well as the back muscles, as well as the pelvic floor. The cornerstone exercise for the pelvic floor is really this exercise called bridging. You're going to line the client up, lying down on their back, feet flat, knees bent, lining up that thigh bone, shin bone, and second toe. And the whole purpose of this exercise is this wave-like movement happening through the spine, driven from the pelvis. So we want that sense of an exhale to draw the pubic bone towards the belly button. Peel the lower back, the lower rib cage up to the mid-shoulder blade area, up. Inhale at the top, and then exhale, reach the body down. And as you go down, you want to think of the body getting longer as you get closer down towards the ground to finally letting that sacrum sit onto the mat. The idea here is we're working all the muscles in that abdominal pelvic region, nothing working harder than it needs to, everything working at the amount that we need it to, so that way the movement feels effortless and we're coordinating all the muscles around this central core of our body. Hope you have enjoyed the power of your flower and you've been able to explore movements beyond just the pelvic floor, beyond just Kegels, and knowing that we are a symphony of muscles working together to be able to work and provide support to our body. We are designed to move, and we are designed to move well. I look forward to you joining me in other of the workshops that we have in Dr. Karyn Staples. We have more in the women's health workshops looking at pelvic pain, pre- and postnatal wellness, and know that we have our Staying Aligned series, both on the shoulder, hip, and ankle. Thank you.